Hi everyone, Natalie here, and today I am going to talk about the neck, and particularly one exercise that can really help for chronic neck pain. Um, a lot of times when we get an injury in the neck, and maybe it's a small whiplash, maybe it's a car accident, maybe you just whipped your head, or you woke up and your neck was frozen one day and everything got really tight. When we tend to get injuries, what ends up happening is those muscles end up becoming slightly inhibited, which means they don't fire and they don't turn on as quickly anymore. Um, and so over time, we end up having chronic neck pain because the neck muscles aren't doing their job to help support your neck. There's a 7 vertebrae right here, and you want to think of it as its own limb pretty much, and you actually do need to start strengthening it if you have chronic neck pain. With that said, studies have been done that show that 90% of people that have chronic neck pain, and remember that's 90%, that's extremely significant. 90% of people have issues with deep neck flexion, which is that forward chin tucking motion and recruiting the correct muscles in order to do that movement. So a little bit of anatomy about the neck. I've got a couple pictures here because that always helps, right? So here is your cervical vertebrae from the back. You can see each of the vertebrae, and the skull actually sits right on top of this C1, and it's kind of flat. So it's like a bowl actually sitting on top of your neck, and it can move in all different directions. So your deep neck flexion is actually going to come from that top cervical vertebrae. You can't actually feel it. The first vertebrae that you feel in your neck is your second cervical vertebrae. It's actually up a little bit higher. There is a way to feel it from the side, but just so you know, it sits a lot higher in your head than you think it actually does. This is just the anterior view, so this is kind of from the front side of what all your 7 cervical vertebrae look like. And flexion will be muscles that kind of attach to the front. We have a lot of layers of muscles that surround the spine in particular, and also in the neck. So I'm not going to get into the specifics about it, but your deep neck flexors, they're called your local muscles, are the ones that attach directly and deeply in your neck. Our larger global muscles are the ones that are on the outside. So if I turn my head, you can see this big muscle. This is considered one of your global muscles, and that's the sternocleidomastoid. So most people, if they have a neck injury or if they just have chronic neck pain, they're moving from these big outside neck muscles, and they're not engaging the deeper, smaller internal neck muscles. Just a couple of photos here. Here's kind of an example of the neck. You can see how there's a little bit of a cutout in some of the deeper muscles, and then the larger muscles on the outside. We have lots and lots of layers. If you look at the spine, there's small muscles that go from one vertebrae to the next. There's ones that jump 2 to 2. There's ones that layer over on top of that. And there's larger neck muscles here, but these are larger internal muscles. Here's that sternocleidomastoid that most of people see when you turn your head to the side. And then I have all of these that are just more and more and more neck muscles, one after the other. There are so many that it's kind of hard to keep up with them all. But if you can master deep neck flexion without engaging those larger global muscles, and by using your deeper, smaller internal muscles, you can actually reduce a lot of your chronic neck pain, because you're going to be starting to engage and move from the stabilizing muscles. Those deep, smaller neck flexors are there to stabilize your neck. And if they're not doing their job, then the other ones are going to get overworked, and that's where we get really tight. Okay, so with that said, I'm going to show you the exercise. I'm going to be using a blood pressure cuff so that I can get some feedback on how I'm performing the exercise. It's really helpful if you have one, but you don't have to have a blood pressure cuff. You can do it without it. This is something you can do laying down, so I'm going to go ahead and demonstrate that now.
All right, so now we're going to focus on the actual exercise itself. I'm going to do a demonstration of the exercise without a blood pressure cuff, and then if you have a blood pressure cuff, I'll demonstrate it with that, so you can kind of see the difference and the kind of feedback that you're going to get. And just a reminder, what we're doing is if this is your neck and this is the frontal view, if you're looking at someone, we're trying to focus on these deep neck flexors, so it's the small muscles that attach the head to the neck, and not the larger muscles that we can feel on the outside. So we're actually going to be feeling our neck. So the way this exercise works is you're going to start on your back. You want your head to be in a neutral position. So forehead and chin should be about the same height. From here, you're going to take your hands, and I want you to feel your neck and really try and get your neck soft. It's a little hard when you're talking through it, but you should be able to feel, if you engage your neck muscles, how tight they feel, but we really want everything to be nice and soft and loose. From here, as we do this exercise, you're going to think about your head sitting on top of your neck, and you're literally just rotating your skull forward, which is the chin tuck motion. And it should feel like the movement is happening from way up top, kind of back and inside behind your skull, behind your ears. That's where the flexion is coming from. When we do that motion, it's going to be very subtle and very small. So feel as if you're lengthening from the back of the neck, just to about there. And if you notice these neck muscles starting to engage, if they're sticking out at all, soften them. Try again, feel that motion lengthening from the back of the neck, and keep everything soft up here. So once you've found that chin tuck, you're going to hold for about 10 seconds. And then you're going to relax and release. You're going to do that about 10 times. So again, thinking about lengthening, doing your lengthening from the top and the back of the head, so there's a slight rotation happening, but just enough before any of these larger neck muscles start to engage. The first couple you do, you're going to feel like you're not really doing anything. It takes a couple repetitions to start to feel these muscles lengthening. It's a very, very subtle exercise. Once you've done a set of 10, holding for 10 seconds, and you actually get up off the floor, you will feel some warmth all up in through here. It's almost like you stretched out all of those neck muscles, those little teeny tiny neck muscles up in the back of your head. So that's how you're going to do this exercise. I would start with 5 to 10 second holds. Again, making sure you're not engaging with the larger muscles, and then do that 10 times. As you get better and better at it, you'll be able to hold for longer, maybe 20 seconds, 30 seconds, eventually up to a minute. And you'll also be able to tuck your chin further without these deeper neck flexors engaging. But initially, it's literally just that. Just again, so you can see that again from neutral just to there. And I don't know if you saw that, but I could feel this muscle engage when I tucked my chin that time. So really lengthen to about there. Okay. So we're retraining our body to fire and engage different muscles so that we can create some stability with those deep neck flexors. So if you do have a blood pressure cuff, I've got one here so you can just kind of see the difference. Blood pressure cuff, and you're just going to fold it, go ahead and Velcro it. You're not going to put it around your arm, you're actually going to place it underneath your neck. Once you've got that under your neck, you're going to look at the gauge here, make sure it's closed off. You're going to pump it up to 20 millimeters of mercury. And for most people, that should just about support your neck if your head's in a neutral position. Okay, good. I'm at about 20 millimeters of mercury. Even the slightest movement will change where it's at. So to kind of help you out, you can put a pillow on your stomach so that you have a place for your arms with this one, because you don't want to just be holding it up and engaging your arms the whole time. That way you have a place for your hands to rest. So from here, it's at 20. I'm looking at the gauge so that I can see where I'm at. I'm in a neutral position. It's going to be the same thing. I'm going to put my hand on my neck, make sure my neck is soft, and then from there I'm going to do my chin tuck. So if I'm at 20 right now, a chin tuck to 22 millimeters of mercury, right there. It's a small chin tuck. Make sure everything is loose, count to 10, and release. Eventually you can work your way up to 24, so a 24 millimeter of mercury chin tuck looks like that. And back to 20. If I were to go to 26, right there. And back to 20. And if I were to go all the way to 28 millimeters of mercury, this is my starting position. And that is 28 millimeters of mercury. That's even a little hard for me. I can feel already, I don't know if you can see it, but my sternocleidomastoid, those bigger muscles, are actually starting to engage right now. So that's a little harder. My neck isn't strong enough for that yet. I still got to work on my own exercises. But this can be a very powerful exercise. So if you do have chronic neck pain, if you've had any kind of whiplash, any kind of neck injury, you may have muscles that are inhibited, those deeper stabilizing muscles, and this is the way to get them stronger. It's the most powerful neck exercise that you can do to really help yourself. And so I really encourage you to try this out. Maybe get a little bit of feedback. Feel free to make some comments or ask any questions about this one. But it can be really powerful, really helpful. So I hope you at least try it out. Remember to be consistent with your exercises too. Just like the rest of your body, if you don't keep working out regularly, what happens, those muscles go soft and they're not as toned anymore. And it's the same with your neck muscles. They're just like the rest of your body, you know? If you take a shower, you kind of have to shower every couple days because it doesn't stick. Same with working out, same with your strength training. And if you've got chronic neck pain, or you've had chronic neck pain for a long time, you're going to need to keep up with this exercise a few times a week at least. Initially, if you can do it, you know, every other day or even every other day, every day, that'll be really powerful to just build up your initial strength. And then it's just a maintenance of once or twice a week from there on out. But I really encourage you to make some changes, commit to this. Feel free to message me or contact me if you need any help, you've got any questions, you want some accountability, or just a little bit of feedback. I know it's kind of hard to do it from afar, but I will do my best. Okay, so I hope you enjoyed this video. I hope it's helpful. Feel free to share it, try it out yourself, and let me know how it goes. Bye.